Welcome to this week's edition of Artificial Intelligence in Healthcare and Digital Health Updates, covering the latest breakthroughs. Brought to you by LucidQuest. A meta-analysis of 65 studies shows nearly 77% of people are willing to share their health data, especially in high-income countries. Participants favor research institutions over commercial groups, emphasizing privacy, consent, and transparency. In geriatric health, experts propose a policy roadmap for AI adoption. Key steps include CMS reimbursement, joint FDA-CMS review, interoperability standards, and a national geriatric data trust to ensure safety and equity. Epic has introduced native AI charting in its electronic records using Microsoft's Dragon Ambient AI, with rollout expected in early 2026. This marks one of more than 160 AI initiatives spanning risk calculators, virtual assistants, and imaging summaries. The CARE-AD system, a multi-agent large language model, analyzes clinical notes to flag Alzheimer's risk up to a decade early. While validated only on veterans' health data, it outperforms single model approaches, pointing toward future decision support tools. Clinician surveys reveal reputational concerns around generative AI. Doctors relying on AI are viewed as less skilled, though framing it as a verification tool helps soften skepticism. Accuracy gains are recognized, especially with institution-specific models. In multiple sclerosis, a probabilistic model of over 8,000 patients identified disease progression drivers, highlighting inflammatory brain damage as a key factor. Researchers call for updated MS classifications to guide treatment and trial design. Patients remain cautious about AI in dermatology. They support AI-assisted teledermatology with clear clinician oversight, especially for skin cancers, while raising concerns over privacy and dataset equity. In asthma, natural language processing of more than 22,000 pediatric records identified early risk subgroups, enabling targeted prevention and monitoring. MIT's COMET model is advancing RNA therapy delivery, predicting more effective lipid nanoparticles than some commercial options, with implications for obesity and diabetes treatments. NICE has conditionally recommended 6 digital cardiac rehabilitation platforms for NHS use, requiring evidence generation over the next 3 years. A handheld AI-powered thermal imaging tool reached 94% accuracy in detecting skin cancers and is entering expanded trials in Australia. Finally, Mindler has acquired ESO Digital Health UK, combining reach with AI-driven CBT models to expand access to mental health services across Europe. Stay ahead in AI and digital health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.